Imagine a healthcare system where your doctor has instant access to all your medical history, no delays, no paperwork, no missing pieces. That's the vision behind the Provide Access API, part of the CMS 0057F final rule. This API enables healthcare providers who have a treatment relationship and an agreement with the payer to securely access their patients' comprehensive health information. It is particularly beneficial during a patient's first visit to a new doctor or when the patient has received care across multiple healthcare organizations or care settings, allowing the provider to view a complete and longitudinal health record beyond what is available in the local EHR. Under the CMS 0057F final rule, all impacted payers must make key data available through APIs, including claims, encounter records, and prior authorization details, similar to what's already shared through the Patient Access API. To stay compliant, payers must implement and expose secure, standardized FHIR R4-based APIs and authorized providers can use to retrieve this information quickly and efficiently. But that's not all. Payers are also responsible for educating patients, clearly explaining how their data will be shared via the Provide Access API, highlighting the benefits like improved care coordination, and most importantly, informing them of their right to opt out. Patients must receive these instructions in plain, easy-to-understand language, empowering them to make informed choices about their health data. All these requirements must be fully implemented by January 1st, 2027. Meet Dr. James Smith, a primary care physician at Grace Hospital. He has recently started treating a new patient, Jack Shah, who is currently covered by the United Care Health Plan. Jack Shah has a complex medical history, having received care from multiple clinicians and hospitals over the years. To make accurate clinical decisions and ensure Jack receives the best possible care, Dr. Smith needs to access to Jack's complete medical history, including past visits, treatments, and interactions with other healthcare providers. Thanks to the Provide Access API, this vital information is securely retrieved from Jack Shah's current insurer, United Care. This ensures continuity of care, helps avoid unnecessary tests or procedures, and ultimately supports better health outcomes for Jack. Dr. James Smith, a primary care physician at Grace Hospital, logs into the EHR system to access patient Jack Shah's clinical history. Using the Provide Access API, mandated by CMS 0057F, he initiates a request to view Jack's past encounter data. Since Dr. Smith has both a contractual relationship with United Care Health Plan and a treatment relationship with Jack Shah, access is granted. The data includes previous visits, treatments, and interactions with multiple providers, helping Dr. Smith avoid duplication and make informed decisions. The process begins with the EHR app triggering a request to the bulk data client. The client sends a FHIR export request to the United Care FHIR server, specifying the encounter resource and patient details. The FHIR server processes the request, generates NDJSON files, and stores them in the output file server. It then returns a status URL that the client polls to check for completion. Once the export is ready, the client receives download URLs for the encounter data files. These files are then retrieved and sent to the local FHIR server within the provider's environment. The local FHIR server transforms the NDJSON data into structured FHIR resources, making it available to the EHR system. Finally, the EHR application queries the latest data from the provider's FHIR server and displays Jack Shah's complete medical history to Dr. Smith, enabling him to deliver safe, personalized, and well-coordinated care. To support this seamless data exchange, several core components are involved both on the provider side and the payer side. On the provider side, we begin with the bulk export client hosted within the provider's environment. It automates the process of retrieving patients' health data by triggering a FHIR Bulk Data export operation to the payer's FHIR server. It continuously monitors the job status by polling the status URL and downloading the NDJSON files once ready. This client is built using the WSO2 Accelerator for healthcare, ensuring FHIR compliance and alignment with the CMS 0057F final rule. Next is the FHIR app, the main interface for providers. This application allows healthcare professionals like Dr. Smith to log in, initiate data retrieval requests, and view a patient's medical history such as past encounters once the data export is processed. Next is the local FHIR server, which receives the NDJSON files, transforms them into structured FHIR resources, and stores them in a queryable format for real-time access by the FHIR app. This is implemented using the WSO2 Accelerator for healthcare. On the payer side, the central component is the FHIR server. It exposes patient health data like encounter records and diagnostic reports in a standardized FHIR format. It integrates with the payer's internal systems of record, such as databases and claim management systems, to extract the necessary information and respond to authorized data requests. Finally, the output file server hosts the exported NDJSON files. Once the export is complete, authorized clients can securely download the patient's historical data from this server. Together, these components ensure a secure, standards-based, and efficient exchange of patient data between providers and payers, just as envisioned by the CMS 0057F regulation. This demo setup mimics an electronic provider access flow, orchestrating interactions between the provider's FHIR app and the payer-side infrastructure. It connects the demo FHIR application with the appropriate FHIR server as needed. Leveraging WSO2 Accelerator for healthcare enables seamless data exchange throughout the workflow. The developer console provides complete visibility into the system's behavior by displaying detailed API call information, including request and response data and endpoint URLs, ensuring transparency and aiding in debugging. First, Dr. Smith logs into the FHIR system. After a successful login, he is taken to the main dashboard. From there, he selects his patient Jaksha and clicks on the patient history option. This action initiates a bulk export operation using Jack's patient ID and begins retrieving his patient's medical records from the respective payer. Once the export is completed, the system confirms that the data has been exported. Dr. Smith can then choose the specific type of data he wants to review. In this example, he selects Encounter History, which displays a detailed list of Jaksha's past encounters. On the side, the developer console shows the corresponding API call used in the process, offering full transparency into the data exchange and helping ensure everything is working as expected. The Provide Access API, as defined in the CMS 0057F final rule, is a pivotal advancement in enabling timely, secure, and efficient data sharing between payers and healthcare providers. By granting authorized providers access to critical clinical data, this API supports better care coordination, reduces duplication, and enhances decision-making at the point of care. Through standardized FHIR APIs and a clear focus on interoperability, CMS 0057F ensures a more connected and patient-focused healthcare landscape. At WSO2, we are committed to supporting your journey towards CMS compliance. Our WSO2 Accelerator for Healthcare and Devant platform offer pre-built integrations and healthcare-specific tooling to help you accelerate adoption, ensure interoperability, and deliver meaningful value to both patients and providers.